In July 2024, the UK government quietly scrapped a long-awaited consumer protection, a lifetime cap of £86,000 on personal care costs. For families facing catastrophic bills, the decision was a tragedy, but for local councils, it was a relief. The cap was projected to cost £30 billion over a decade, and there was no actual funding set aside to cover it. This reversal highlights the structural divide in British healthcare. Unlike the NHS, which is universally free at the point of use, adult social care is a fragmented, means-tested, and highly marketized system. This data shows demographic pressure accelerating the crisis. Between 2025 and 2040, the population over 65 is projected to grow 27%. The workforce is already strained. There is only one care post for every 7 people over 65. By killing the consumer cost cap, the government signaled a major change in strategy. They stopped trying to subsidize what patients pay and started trying to rewire the labor market that actually provides the care. This pivot has locked the sector onto a rigid multi-year timeline. Every major reform is now racing toward a deadline in 2028, the moment this new model for care faces its first massive real-world test. The government's main tool is the Employment Rights Act 2025. This law created the Adult Social Care Negotiating Body, which brings together trade unions and care employers to establish sector-wide collective bargaining. The goal of these negotiations is to implement the sector's first legally binding fair pay agreement. According to this official roadmap, that agreement is scheduled to take effect by autumn 2028. To back this shift, the government has earmarked £500 million in dedicated funding for the 2028 to 2029 financial year. However, financial friction is already building. Independent providers are being squeezed by rising national insurance contributions and new mandates to move staff off zero-hours contracts, costs that are landing years before the Fair Pay Agreement funding arrives. Higher pay and better conditions are vital for the workforce, but dumping these mandates onto a financially fragile market creates a structural trap. If the providers can't afford the new rules, the entire system of care delivery is at risk. While small, family-run homes struggle to stay open, the largest private equity-backed providers operate with opaque financial structures that prioritize hidden profit extraction. The most common tactic is debt loading. The 5 largest private equity-owned providers have burdened their homes with high-interest loans from related companies. On average, £102 per bed per week is diverted purely to pay interest on this debt. Then there are sale and leaseback schemes. Providers sell their real estate to investors and then rent those same properties back, often through related offshore companies. This revenue bypasses the facility entirely, leaving less for food, facilities, and staff. This chart shows the scale of the funding gap. The government's £500 million pledge is significant, but independent analysis suggests it would take £2.3 billion just to match the wages of clinical support staff in the NHS. Local authorities warn that this deficit is unsustainable. Forcing an underfunded wage mandate onto an extractive corporate structure will likely trigger mass bankruptcies among the very providers the country relies on. By the time we reach 2028, the sector will hit a convergence point. The Fair Pay Agreement will launch just as Baroness Casey's independent commission delivers its final blueprint for reform. That blueprint centers on a national care service. The ambition is to build a system that mirrors the NHS, integrated, nationally consistent, and universally accessible. This represents a change in the country's priorities. The focus is shifting away from protecting private inheritances and toward transforming the lives of the 1.5 million people who do the work of caring for the elderly. But the financial reality remains grim. Without billions of additional pounds to bridge the gap between union demands and market structures, the vision of a national care service remains a paper ambition. 2028 is the inescapable threshold. It is the year when the UK adult social care system will either finally transform into a unified public good or buckle under its own contradictions and completely collapse.